Okay, guys. So what I'm telling you is like if the people is just calling you or fax you paper, you need to send it. We can't decline that situation. We have to give the Schedule 2 drug for that kind of situation, for a hospital care or terminally care or community-based care. We have to send them that medication. We can't reject it. But you can see here is telling you only the emergency situations are verbal order for the Schedule 2 medication. See here, this is another circumstance, okay? This is an emergency situations. So like something happened, you just like there is a accident happen, and you know that that time there is a lot of pain, right? So at that situations they need some set of drug to keep that pain relief. So we use sometime morphines to reduce the pain, and that is opioids, or these are the scheduled drugs. So this is the emergency situations. The quality of medication dispensed is confined to the amount needed in emergency situation. They can ask you. Actually, this is done by the doctor if they call the pharmacy, and they give all the details, and they have to supply on the emergency situations so they can tackle the situations. So for that emergency situations, if you call them and get the medication, they'll provide you, but your they'll take your all the detail, especially for the prescriber. And so the prescriber job is within 7 days, the emergency verbal or order written prescription for the amount dispensed must be mailed or delivered to the pharmacies. Now see here, uh, I told you like when this is another situation. This is not the situation of hospital care, okay? This is another situation. This is a situation on the emergency. So in the case of emergency, if the doctor called you on the pharmacies, and then you just provided the amount of drug for that situation to tackle that. So like the doctor responsibilities is gonna be like up within 7 days they have to send the written prescription to the pharmacies for how much drug which is delivered by the pharmacy to tackle that situation, okay? And this is the responsibility of doctor. So 7 days, within 7 days they have to, but they can accept the verbal call and deliver the drugs to the patient at the emergency situations. Okay, this is the situations. So we have already told you we're gonna accept the verbal calls and faxed, one in the hospital cares and another one is the emergency situation. But in the emergency situations we're gonna follow the, we have to again send the prescription to the pharmacies. That's a law. All right, now see here. So inventory of a Schedule 2 medications. A continuous log inventory must kept log inventory must be kept for the Schedule 2 medications. So what do you mean by inventory actually? Anybody can tell me?
Please say that one more time.
Like inventory means whatever the goods in your shop, especially the pharmacy, how many they have pills, how many they have drugs. These are your inventory, okay? So actually what we do, basically we are not talking about other drug, we are only talking about the Schedule 2 medications. So you can see here it is telling you a continuous log inventory. So like after selling that, this is expensive and this is restricted drugs, so the pharmacy's responsibility is we have to keep counting the drugs, like how many we sell and how many we have in the bag, so we can't misplace it. This is a we have to do. So we will do continuous, like sometime we will check it, not frequently, but we have to maintain the log. Otherwise, sometimes you misplace some drugs, and if the infects like inspections is come to you by the DA, and they're gonna ask you what you did. So at that time you have to tell them we have this much. So it is good to be in safe side. Okay, so that's why we need to check Schedule 2 drug. We are only talking about the Schedule 2 drug, so don't confuse for others. So now see here, each quarter manual inventory need to be reviewed and compared line by line with the pharmacy electronic inventory system. This inventory is separated from the log of other medication. Schedule 2 prescriptions also should be filled at a separate time or counted from other prescription and returned to the secure storage area. These drugs should never be left out in the open, right? So this is a sensitive. We have to keep this drug in the safe area. All right. Now this is all about the inventory for the Schedule 2 drugs. So you always, while you are giving, you need to keep it in safe place where it is. Don't mix it up with another Schedule 2 and 4 drugs. Now see here. So record retention. So we are talking about now record retention. What happened on that one? So paper prescription must be kept on a file for 2 years, right? We already know about that. Electronic log inventory must be stored permanently. The other retentions requirement for all of the various type of record used in a pharmacy can be found in the credible published pharmacy journal, websites, and information venue. So this is all about your. So we're gonna talk about some restricted drug. Okay. So what do you mean by restricted drug? Actually, this means like this drug is already published in the market and they are already used by the women, and what happened after using that, it's affect the peoples. It is like it's a problem, and then then the WHO or health organization thought, okay, this drug need to be have a restrictions. People need to be in restriction. It's still used, but it's have a restrictions. So you have to check what are the restrictions and when you gonna sell that drugs. So what are the restricted drugs? You can see here. You can see here. It is called thalidomide, isotretinoin, clozapine, right? So over here there is only three drugs which is need to be before somebody, if somebody is buying that one, we have to check it. These three drugs, so keep in mind, the first one is thalidomide, second one is the isotretinoin, and the third one is clozapine. There is a several, but for the example you need to learn this one. So these drugs is while it is in the market, it's create a lot of problems if they don't use it with a precaution. Okay, so let's talk about thalidomide. What type of precaution we need to take if we are taking thalidomide? Okay, so the program steps therapy. Always remember, if it is written steps, that means it is talking about thalidomide. Okay, so this is called STEPS. Full form is System for the Thalidomide Educations and Prescribing Safety. So we have to follow this one. Like even the doctor have to follow when they are going to prescribe thalidomides. If they don't and something happen, then he will be the responsible. Now see here what type of restriction we're gonna follow. It's used for the patient that are prescribed thalidomide mandatory counseling. See here, you have to counsel that, especially the doctor need to be counseling for the pregnancy test. Okay, they will always take a pregnancy test for that person who gonna use the thalidomides, and if it is positive, then it is not gonna be, they will not prescribe you thalidomide. Okay, because it is harmful to the baby. It might lead so many abnormalities or miscarriage of the baby will die, and so the patient need to be negative pregnancy, and registrations are required before the patient can receive the first prescriptions. Then and continue regular pregnancy screening and counseling are required for the patient before refill can be dispensed. So even if it is a refill, they have to first confirm that she is not a pregnancy. Okay, so this is thalidomide and it is belong to the steps program. Okay, so keep in mind that. So if your patient is, if the doctor patient is the pregnant, we never gonna give the thalidomide. As well, we're gonna talk about isoteridoin. You might listen isoteridoin. You know the acne, right? The acne, like especially this is used isoteridoin to treat the acne. So it have also so many severe effect and side effect. So we have to follow the what are the restrictions. So you can see here the iPlace program. Okay, guys, if they're gonna ask you if it is written step therapy, you need to know that it is talking about thalidomide. And what is the precaution we need to take? No pregnancy. Okay, if it is pregnant, we will not prescribe it. We will not give the drug to the patients. And even they are coming to the pharmacy, there is a pregnancy test. They have to keep it with that. Now see here the isoteridoin. So isoteridoin, it's belong to the iPlaced program. Remember this one, this term iPlaced, IPLEDZE program is used to confine drug distribution before the patient can receive their first prescriptions. They must register for the program, undergo pregnancy testing if applicable. So even this one, they have to do the pregnancy test. Okay, choose two type of birth control and promise to keep all the scheduled appointment. In order to refill subsequent prescription, female patients need to take monthly pregnancy test, use a iPlace system to describe the method of birth controls, and answer questions the iPlace program. So the isoteriton is the iPlace program, which gonna give you some knowledge about these drugs. And while prescribing, you need to check the pregnancy. If the patient is pregnant, we're not gonna prescribe isoteritin. Let's talk about another drugs that is called clozapine. Okay, this is called clozapine. This is used. This prescription medication required using program to track the patient's white blood cell count. See here, if you are using this one, then it have a severe side effect. It might make your problem in your blood, that called white blood cell count. It always decreases actually. That's why what we do when we are taking the clozapine, at that time we have to check the blood test. We need to check our blood cell, okay, number, how many is there, because it has the side effect. It's gonna drop your blood count. So absolute neutrophil count, especially on the neutrophil counts, it's gonna do that. There are different programs through the each manufacturer. Any of the programs are acceptable as long as pharmacist and prescriber can have access the file to see the patients is reacting to the medication. So like before prescribing these drugs, we have to check his blood, and especially the neutrophil count. This is the component of the WBC cells. Okay, that's all for today.